Welcome to the short introduction on economic evaluations. My name is Robin, and I am a research associate with the Pragmatic Clinical Trials platform. I will be taking you through the rationale and basic characteristics of economic evaluations. After this lecture, you should be able to understand the rationale for conducting economic evaluations, identify the different types of economic evaluations, understand the methods used for conducting economic evaluations, identify the major considerations when implementing an evaluation, and understand the strengths and weaknesses of economic evaluations. Policymakers are interested in what courses of action are available to address the differences in health, attributed to genetics and heredity, environment, healthy and unhealthy behaviors, and luck. The focus of health policy is on prevention and producing health. Health economics and economic evaluations are interested in informing decisions about the optimal allocation of resources. The goal of healthcare is to improve population health by protecting individuals and populations' existing health from emerging health risks. This is accomplished by avoiding or curing disease. Because without health, we are less productive or not productive. Without health, we engage less or not at all in leisure activities and consumerism. Without production and consumption, there is no wealth production in society. The main issue facing universally funded healthcare systems is scarcity. Universally funded healthcare systems have a limited amount of resources to meet all the needs, demands, wants of the population. Choices need to be made regarding how to use resources for health-producing activities. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absences of disease or infirmity. Health may be interpreted as the ability to adapt to physical, mental, and social challenges throughout life. Health can be produced by investing in health technologies, healthcare programs, and healthcare professionals. How do we allocate resources to maximize health? What types of information or evidence are needed to inform these decisions? We need evidence and information to inform decision-making. The first step is establishing efficacy. Is the health technology better than a placebo? Then it is said to be efficacious. The second step is establishing effectiveness. Does the health technology work in real-world situations? Then it is said to be effective. The third step is establishing efficiency. Is allocating money to this effective health technology money well spent? For example, is funding this health technology the best way to spend scarce resources? Can we produce more health by reinvesting it elsewhere? Information on value for money is needed. Economic evaluations are a way to generate this type of information. The last step is implementation. Is the health technology reaching the target population? Can it be demonstrated that the technology was implemented efficiently and effectively? The goal of economic evaluations is to identify, measure, value, and compare the costs and benefits of alternatives under consideration. Economic evaluations involves the identification of potential alternatives, their consequences and costs, and the values of these and how they compare to each other to inform a decision. This is different than conventional research, which are designed to test hypotheses. Health economics is the application of economic principles to health and healthcare. Economic evaluations are interested in informing decisions. Scarcity requires choices to be made regarding how to use scarce resources. Healthcare systems cannot fund every beneficial intervention. It needs to make choices on how to get the most benefit from the limited amount of resources available. The evidence generated from economic evaluations are used to inform and help decision makers decide whether health technology being investigated is better than usual care, or what is currently being done. For example, buying a new car. The old car works, and there's a limited budget. How much better is a new car over the old car? Is it worth spending the extra money for a new car? Do the benefits of a new car outweigh the costs? Economic evaluations makes it possible to examine whether the money that would be invested into a new intervention will be used efficiently. This is usually done by making comparisons. Is the new car better than the old car? In healthcare, is the new intervention better than what is currently being offered. There are various types of evaluations, each with different implications. The difference is how the outcomes are measured and valued. For example, in cost-benefit analysis, the outcomes or benefits are in dollar amounts. In a cost-effectiveness analysis, the outcomes or benefits are in natural units. In a cost-utility analysis, the outcomes or benefits are measured with utility-based estimate, often expressed as quality-adjusted life years. Cost-benefit analysis is a type of economic evaluation where the costs and benefits are both measured in monetary units, for example, in Canadian dollars. Measuring costs and benefits in monetary units allows for cross-sector comparison. For example, comparing healthcare programs for the elderly to educational programs for children. Cost-benefit analysis requires all costs and benefits to be appropriately quantified in monetary units. One of the major limitations to cost-benefit analysis is a difficulty in converting certain aspects of health into monetary units. For example, how would one objectively assign monetary values to patient satisfaction with care, improved mobility, or improved mental health? Cost-effectiveness analysis is a type of economic evaluation where the costs are measured in monetary units and the outcomes are measured in natural units. There is no attempt to attach a monetary value to the outcomes. For example, natural clinical outcome measures include number of symptom-free days or the number of life years gained. One major limitation to cost-effectiveness analysis is the inability to compare health technologies with different effects. For example, how do you compare a health technology that reduces heart attacks to a technology that increases the number of symptom-free days? This type of analysis restricts comparisons to health technologies that have similar types of effects. Cost-effectiveness analysis is the most useful in situations where a decision maker operating within a fixed budget is considering a limited range of options within a given field. For example, comparing different pharmaceutical products that reduce blood pressure in adult patients. If one wants to make comparisons between different interventions across different diseases, for example, chemotherapy for treatment of the colorectal cancer that provides patients with a longer life expectancy, compared with antihypertensives in the prevention of heart attacks, then a new type of measure is needed to allow comparison. This requires utility-based measures such as the quality-adjusted life year. Cost-utility analysis is a type of economic evaluation where costs are measured in monetary units and outcomes are measured in healthy years. A healthy year are represented by a multidimensional utility-based measure which combines life years gained with some judgment on the quality of those life years gained. A common measure for healthy years is the equality-adjusted life year, which is the main measure used in cost-utility analysis in Canada, the United Kingdom, and the United States. The strength of cost-utility analysis is the ability to compare within and across different diseases. For example, with a common measure of benefits of a health technology, a comparison of health technology and oncology compared to family medicine is possible. The quality-adjusted life year combines the quality of life with the quantity of life. Quality of life is represented by a value between 0 and 1, where 0 is no health and 1 is perfect health. Length of life is represented by the duration living in a particular health state. By weighing quantity of life by the quality of life, quality-adjusted life years value years lived in less than full health less valuable than years lived in perfect or full health. Having a common outcome measure allows for cross-disease comparisons. For example, treatments for cancer can now be compared to treatments for chronic hepatitis C infection. To calculate quality-adjusted life years, multiply the utility value with the number of years lived in the health state. For example, a home dialysis patient with a utility weight of 0.65 lives for 8 years, has a quality-adjusted life years of 5.2. Quality-adjusted life years weighs length of life with the quality of life. Would it be worthwhile to extend your life by 20 years and live in disability where daily activities are difficult? Economic evaluations generate information on value for money. This provides comparative information on costs and benefits of treatment alternatives. Different types of economic evaluations exist, and they differ on how they assess the outcomes. Economic evaluations involves the comparison of two or more alternatives, the comparison of their consequences and costs, and the value of these and how they compare to each other.